Thank you for joining us today on VoicesAcademy.com. Our topic is pediatrics, and our guest is Hoda Shaki, a pediatric nurse practitioner in Southern California. Thank you for joining us.
Thank you for having me.
Now, let's start by helping everybody to understand what a nurse practitioner is and what a nurse practitioner does.
A nurse practitioner is a nurse who is an RN with advanced practice training in a specific specialty. So for me, I have advanced practice training in pediatrics, which means I've earned a master's degree, and I'm able to use the knowledge and training that I have as a nurse, but take it to another level and actually assess patients and diagnose and treat certain conditions with collaboration of a doctor who is trained in pediatrics for support and collaboration when needed.
And what are some of the settings where a pediatric nurse practitioner might be working?
Pediatric nurse practitioners work in a variety of settings. Those who have acute care training can be in a hospital and can actually work in an emergency room or an ICU or on the pediatric floor. A lot of pediatric nurse practitioners, because they're trained in primary care, will be in general clinics, taking care of children if they're sick, as well as doing child care, meaning doing physical exams and things like that.
Great.
There's also pediatric nurse practitioners that work in schools and school-based clinics. And in areas where there's not a lot of access to doctors is usually where you'll find nurse practitioners working as well.
Okay. And so we're going to focus our conversation on primary practice, or in other words, clinical care, rather than any inpatient setting. Mm-hmm. And now you're working with a pretty large range of ages, correct? From babies through teens.
Mm-hmm. I work with babies from the minute they're born, usually seeing them sometimes at day one, all the way until a child is 18 and at times 21 years old as well.